Madam Speaker, for giving me an opportunity to support this motion by Senator Sylvia Kasanga and Mercy Chebeni, which seeks to establish the establishment of mental health and psychosocial support centers at the county level. Madam Speaker, the World Health Organization lists Kenya as among the countries that do not have a separate budget for mental health. And Mr. Speaker, sir, this is a serious problem because back in 2016, the estimates were about 11.5 million Kenyans were suffering from mental health. And you know, some people don't really understand this whole concept of mental health. And I thank the senator from Kisii for really demystifying the whole issue of mental health. Because sometimes a lot of people think that mental health is when you've gone completely cuckoo and the only place that you can be able to be sent is Mathare. Madam Speaker, Mr. Speaker, sir, it is important that county governments are involved in this issue of trying to support the welfare of Kenyan people. The mental welfare of our society is very, very important. Every so often, all of us suffer some form of mental illness. Some of us are stressed on a daily basis, Mr. Speaker, sir. Some of us go through depression, Mr. Speaker, sir. Some of us abuse alcohol, Mr. Speaker, sir. Those are all forms of mental healthness. And it is sad that in this country, we call Kenya, where we fight so much and we brag about having a huge budget focusing on healthcare, that we cannot even support the people who are suffering from some form of mental illness. Mr. Speaker, sir, I worry about the disabled in this country. You find that somebody is disabled. That was not what they intended in life. It just happened to them. And then on top of that, they also suffer some form of mental illness. Now, if this country cannot come up with a separate budget which is dedicated to building these healthcare facilities, how are they going to be able to support this economy, Mr. Speaker, sir? Mr. Speaker, sir, this is an excellent motion, which I hope that even the Ministry of Health is keenly listening. Because when you try to look at the number of shrinks or psychiatrists, doctors in this country, it is below par. Mr. Speaker, sir, when you look at the nurses who are trained to be able to attend to people with some form of mental illness, there are very few. I remember reading somewhere that there are only 427 in the whole country. Mr. Speaker, sir, when we talk about devolution, today I was actually saddened to read something in the papers that says that county government will lose most of their health budget. This is absolutely ludicrous. What we need to do is to focus on building our healthcare facilities, the well-being of this country. What really annoys me the most, Mr. Speaker, sir, is that even insurance companies in this country do not pay for mental illness. Yet it's a form of getting health support. So, Mr. Speaker, sir, it is very, very important that when we talk about building policies in this country, we should really consider these people who suffer from some form of mental illness. That is the only way we can be able to build this country. When you read that, according to the Kenya health policy, that about 25% of those people who seek outpatient treatment suffer some form of mental illness, it worries me. And then when you go and you find about 40% of the people who seek for inpatient treatment have some form of mental illness. And when they go and seek this support, they lack where they can be able to go, Mr. Speaker, sir. In the whole entire country, the move of this motion stated that there are only 18 facilities. Mr. Speaker, sir, if you ask me, some of us where we go and seek some form of support is we seek it in the computer. I've personally downloaded an application called Calm to probably calm me down from all this stress of this work. So seriously, if all of us are going to be trying to find some solution, yet we have a country, we have taxpayers who pay money, we have devolved services, but we don't want to accept that we've devolved them, it actually begs a lot of questions in terms of our priorities in building a healthy nation. Mr. Speaker, sir, you find that when some people, especially in rural areas, cannot be able to get access to any form of support, maybe from depression, from stress, this escalates further to a point where they completely go cuckoo, Mr. Speaker, sir. And the only place that their family sent them is Mathare. Mr. Speaker, sir, this is something that has affected me as a person in our family, where at a younger age, my brother was diagnosed with some form of depression. And because there's nowhere he could be able to seek support, he was sent to Mathare. That affected his quality of life. Most people in this country who live in rural areas or in slums end up suffering tremendously. Their quality of life completely changed because this government has not sat down and developed a policy that builds or that comes up with a completely separate budget to cater for the mental health care facilities. I think, Mr. Speaker, sir, it is important that when we are talking about devolution, we look at it wholesomely. We ask ourselves, as a person, what would I want to be able to have around my surrounding? A person from Narok should not be coming to go to Mathare to be able to speak to a shrink if he's going through some form of depression. A person from Samburu should not travel all the way to Nairobi to be able to go to Kenyatta National Hospital to seek for some form of mental support. Mr. Speaker, sir, it is a high time that the Ministry of Health really listens to what this country is calling for. We are calling, and that is the reason why, Mr. Speaker, sir, we are in this house. We want to ensure that all our counties, the 47 of them, at least we have one mental facility with all the services available, with shrinks, with nurses, with even some training facility that can be able to come up with programs that can go outreach, like some outreach programs to reach out to the rural areas so that they can speak to other people who cannot be able to understand these things. It would be imperative for us as a country to make healthcare, not only healthcare in general, but mental healthcare as part and parcel of our daily policy. Mr. Speaker, sir, it is sad, and I hope that we can be able to really think about this nation in a more progressive way, in a healthy way. I agree with Senator from Kisii when he said that most of us, even politicians here, suffer from some form of mental illness. We are depressed every day. You live here, you go, you look at your cell phone, you find a lot of text messages, someone so-and-so has died. You're supposed to, carry all this burden. Someone is asking for money to go to school, you become stressed. Sometimes it's unfortunate, but now you go home and you cannot even be able to fulfill your family duties. Very soon your wife divorces you because you are not even able to satisfy her needs. It is very sad. These are things which have completely driven us cuckoo. So, Mr. Speaker, sir, I support this motion entirely, and I want to encourage this government to come up with policies that demand, one, the establishment of these mental facilities in all 47 counties. Two, move forward and actually demand that these insurance companies that are benefiting so much from Kenyans who pay millions of dollars towards healthcare cover even mental illness. Mr. Speaker, sir, the poor people of this country, I dare say that most of them who die out of depression, mental illness. But it is very hard for us to ascertain that because they don't even have a place that they can be able to go or any form of records that can show that X number of people died out of this. So, Mr. Speaker, sir, with those few remarks, I just want to end by stating the following. By establishing those mental facilities or healthcare facilities in counties, the Ministry of Health should also come up with a support program for the professionals, those few professionals who are in this country. I dare say that a majority of them actually end up dying of depression because they do a terrible job in taking care of their own health. Those people who are tasked by the job of giving support to the mental illness, or those people who suffer from mental illness, most of them also end up going cuckoo. Because, Mr. Speaker, sir, the thing they go through, they just cannot stomach the fact that they really want to help these people. But it is very expensive for these people to come to them. So when they go back to their rural homes, they are told, oh, you know, so and so. That person died, bana. Stress. And he's sitting down and saying, I was in Nairobi. I wish I could be here to save that relative. So, Mr. Speaker, sir, with those few remarks, I hope that the national government and the county government will work closely together to be able to fully establish these mental health centers, fund them, and support them. You know, once they do that, they now even encourage our youth. They encourage Kenyans to be able to pursue careers in mental health care. A lot of people, I'm sure some young people, when you ask them if they want to become shrinks, they'll tell you, yes, I would want to be able to help somebody. Mr. Speaker, sir, I want to commend the NGO world. Here in Nairobi, I know of two. I know Amani Counseling Centers, where they do a lot of work across the country. It's an NGO. You know, we pay taxes in this country. All work should not be left to aid. It is making us become beggars. It is actually putting us in a very awkward position, Mr. Speaker, sir. No wonder some of us choose to download applications that can help us sleep when we are so depressed, because there's nowhere we can be able to get this. So, Mr. Speaker, sir, with those few remarks, I beg to support this motion. Thank you, Mr. Speaker.